Okay, so let's talk about vitamin D, shall we? Vitamin D, a beautiful, wonderful vitamin that has some incredible benefits and some misconceptions. So let's clear it up and let's get to the bottom of this. So, vitamin D, what does it do for you? Well, it has many, many benefits, almost more than any other vitamin. It helps your bone health and your bone strength, prevents osteoporosis. It helps with your immune system, immune health, really important right now in the case of a pandemic, right? Muscle strength, that's really valuable to have. Cancer prevention, did you know that? Vitamin D can help prevent cancer. Mental health, this is a big one. Vitamin D, appropriate levels can actually help prevent and improve depression. So that's really valuable. And then some studies have shown that if you're taking vitamin D, if you have adequate levels of vitamin D, it can decrease all level mortality, okay? So basically vitamin D can extend your life. What an incredible vitamin, okay? We need more vitamin D because many of us, if not most of us, are actually pretty low on vitamin D. If you were to go out and get your blood drawn right now and check your vitamin D level, more likely than not, you would have lower levels than you want. So, what are we to do about it? Well, you may have heard the common misconception that you should go outside and sunbathe to get more vitamin D. This is wrong. Unequivocally wrong. Forget about it. Don't do it. Okay? Can you get vitamin D from sunlight on your skin? Yes. Yes, you can. But I'm going to convince you that it is a bad idea and there are way better ways of getting vitamin D. Okay, so first of all, don't harm yourself in the name of helping yourself. Okay, that bears repeating. Don't harm yourself in the name of helping yourself. It's like smoking so that you can lose weight. Did you know that? Did you know that smoking can help you lose weight? But you would never do that. You would never start smoking because you want to lose 10 pounds, right? So don't do that with vitamin D and the sun. Don't go harm your beautiful skin to try to get more vitamin D. Don't harm yourself in the name of helping yourself, okay? That's thing number one. Number two, you may have heard that getting sunlight on your skin is actually an efficient way to convert pre-vitamin D into active vitamin D. And that's true when it's taken out of context, okay? If you have a toothbrush, imagine me holding a toothbrush here, and you want to go clean the floor. Is it efficient at cleaning the floor? Yes. If you're cleaning a tiny little square, a tiny little space, then it's very efficient at cleaning that floor. But if you want to clean a ballroom floor or a basketball gym, are you going to use a toothbrush? No, you're not, because it's ridiculous. Even if it's efficient at cleaning up a tiny little spot, you're never going to use it to do the full big job, right? And that's what it's like with trying to get all your vitamin D from the sun. It doesn't work for the whole body. You don't get nearly enough, and you're harming your skin in the process, okay? So you're harming yourself, and it's not efficient, okay? So how do we get enough vitamin D? Oral supplement. Oral supplement. If you want to get enough vitamin D, oral supplement. You are probably not getting enough from diet alone. Do you eat a lot of fish? Probably not. Well, maybe you do. Very few people eat enough fish to get enough vitamin D. The sources of vitamin D, do you eat enough mushrooms? Do you eat a lot of mushrooms? Probably not. Okay? The sources of vitamin D are not as abundant as other vitamins. Okay? So you are probably not getting enough from your diet. And even if you try to get enough from the sunlight, you're still not getting enough because it's not efficient for the overall picture, right? We talked about that. So, oral supplement. You need to supplement. Now, this is a point that is up for debate. How much do you need every day? Well, it used to be that, maybe 600 international units a day, maybe 800 for those above 70. Recent studies have shown that you need more than that. You need way more than that. In order to get you into healthy therapeutic levels, you need anywhere from 1,000 units, international units, to 5,000 international units per day. Now, don't take it from me, go talk to your doctor about this, right? Or, even better, go get a blood test and see where your vitamin D level is at. Odds are that you're low and you need oral supplement to get enough vitamin D. It's really important you need to do it. And do not even think about trying to use the sun to get your vitamin D levels. I have a friend, a close friend, who is working with a lot of COVID patients, both inpatient and outpatient. And a lot of these patients are having their vitamin D levels drawn, and essentially all of them are low. All of them have low vitamin D. Now, you would want a COVID patient to have sufficiently high levels of vitamin D, right? Because it helps your immune system. So every single COVID patient in this hospital where my friend works is getting supplemental vitamin D. And they're going home with high levels of supplemental oral vitamin D. So it's a good idea, it's helpful, it benefits so many things, including your skin actually. Your skin and your hair are dramatically benefited by vitamin D. So I hope we've helped to dispel some myths and rumors about vitamin D. And hopefully those of you that are using vitamin D as an excuse to go lay out, hopefully you no longer have that excuse. So I'm sorry, but I'm not sorry. All right, have a good one.